Hey guys, thanks for joining. If you're new here, I'm Alicia. I'm a registered nurse. I've been a nurse for almost 8 years. I have my master's in nursing leadership, and today I wanted to talk about something that is happening to women that they probably never thought would happen to them. So I work in the OB maternity baby world, and something that we're having to do because of this new coronavirus is limit the amount of visitors that are coming in and out of the hospital. And so what that means for pregnant mamas is, this can change between hospital to hospital, but currently at my hospital, women that are admitted for labor or induction are only allowed their spouse and a support person that is a doula. Otherwise, nobody else is allowed. And then once they deliver and go to postpartum, it is only the spouse that's allowed. And I've heard some hospitals aren't even allowing spouses in because they're just trying to limit the amount of people coming in and out, limit the exposure to the pregnant mamas and the babies and the hospital staff, especially with this shortage of the PPE, gowns, gloves, masks, all that. To say quite frankly, it effing sucks. It does. So today I wanted to just go over some pointers for you mamas that might run into a hospital that will not allow your spouse or your doula in there with you. And like I said, this is a really fluid situation, so it can change literally hour by hour sometimes. So what I would recommend is checking the hospital's website where you're going to deliver and see what their current visitor policies are, or calling the labor and delivery unit and asking if at least your spouse is allowed. I also recommend you calling the labor and delivery unit to be triaged by a nurse before you come into the hospital if you think that you're in labor or if you have any concerns, because we want to minimize the exposure between our healthy mamas and any sick people out in the community. So call your labor and delivery, get triaged, and they can give you good advice. We're all trying to do our best to keep moms and newborn babies as safe as possible. As you know, or may not know, pregnant moms are more susceptible to contracting illnesses and getting sick. They have a lowered immune system, and babies have no immune system. So we want to keep you and your baby safe. So with all of that said, I do have some tips and tricks that I learned along the way from my patients, studying, research, classes that I've had to take for working in labor and delivery. And the first thing that I want to just encourage you with is you can do this, mama. You are a freaking warrior. Your body knows what to do. You can do this with or without anybody. Your mind is so powerful. It can help you through this. You have to stay, it's easier said than done, I know, but you have to stay in a positive mindset. You have to continuously tell yourself, I am strong, I can do this. Every contraction is going to bring me closer to snuggling my baby. This is what I've waited 9-10 long months for. I can do this. I am strong. Labor is obviously a very physical experience, but it's also an emotional and mental experience as well. So you have to stay positive and you have to stay focused especially if you want to do this, if you're trying to do this natural. My patients that I see successfully have natural labors, or they labor a long time before they get an epidural, and the ones that truly keep their pain tolerable are the ones that are calm, quiet. A lot of times they have their eyes closed. Sometimes they have a smile on their face, but they are just taking everything within and just doing positive self-talk. You have to keep your mind somewhere else. You have to breathe, and I'll talk about that in a second. One thing that I learned from, I think I learned it in a class, but I actually saw it applied, was one of my first patients on my own as a nurse in labor and delivery. I want to say it was like her 7th baby, and but her labor was still lasting a while, and she said she labored naturally with all of her babies. And what she did was envision herself in a roller coaster. And so she tried to stay calm, stay quiet in between contractions. She kept her eyes closed. She had nice soft music playing. The room was dark, and she was just quiet and like within herself. And when she felt a contraction coming, she felt the pressure building, she would close her eyes and envision herself at the bottom of a roller coaster. And as the pressure is building, she's going up the roller coaster. And you use 10-second count breaths. So she would breathe in for 10 seconds slowly through her nose, and then count to 10 and slowly breathe out through her mouth. And she would just keep doing that, beats of 10, till she felt the pressure kind of stall out, like it's not getting any stronger. And then she felt when the contraction was releasing, she felt like she was going down the roller coaster, and that was her way of keeping focused that yes, it's getting stronger, but it is going to get better. So I actually implemented that when I was in labor, and it really, really worked. I think I labored until like 7 centimeters, but I was a cook balloon 7 centimeters, or if you work in L&D, you know what that means. But it really, really helped. So counts of 10, in through your nose for 10, out through your mouth for 10. Do that all the way from the top to the bottom. That was just one visual representation, but I like to tell all of my patients because it worked for my other patient, and then it worked for me. I felt the relief. So that's just one way that you can use your mind to stay focused on something else other than oh my god, this hurts so bad, because it does fucking hurt. It hurts. Another thing that you can do when you're actually when you're in labor, you're contracting, or you're being induced, is constantly focus on your breath. Try to stay in the zone. It's when you're early on in labor, or you're early on in your induction, and your contractions are maybe every 10 minutes, or they're not that strong. You can watch TV, you can read or dance or talk to your spouse or call somebody on the phone early on in labor. Staying focused on exactly what you're doing can be harder because, it takes a long time. When you start getting into active labor, when your contractions are coming frequently, staying quiet, staying calm, but focusing on your breath is really going to help get you through. The counts of 10 truly do help. So especially now, more than ever, labor at home as long as possible. Some things to help with the pain while you're at home: sit in a warm bath, take a hot shower, let the warm water run over you. That can help distract with the pain. Changing positions frequently, so whether you're kind of swaying on your hands and knees, or you're having somebody push against your lower back to counteract the pressure, whether you're putting your arms on your spouse and kind of like having them sway with you, using massage on pressure points on your feet, massage on your shoulders, stay hydrated. Laboring at home as long as possible will help to minimize the amount of time that you have to be in the hospital. Like I said, you can always call to be triaged by a registered nurse in labor and delivery, so they can tell you whether you need to come in or not, or they'll give you more tips on how to labor at home longer. When you finally do get to the hospital, have a good conversation with your nurse or your doctor, especially if your spouse or doula can't be there with you, so you're all on the same page and they know your wishes and your wants. If you have a birth plan, that's great. Bring it with you, bring a copy. Just make sure that you go over it with your nurse or your doctor. If you're in labor, that can be hard, but just make sure that you give them a copy, tell them to go over it, and you give them the key pointers, but you also have to remain flexible. We want to give you the experience with your labor and your delivery as much as we can, but there are certain guidelines that we have to follow, certain things that we have to do to make sure we keep baby and mom safe. So just communicate with your nurse and your doctor. Some things that a lot of hospitals, at least baby-friendly hospitals, do. We do immediate skin-to-skin. We do delayed cord clamping. We help with breastfeeding. Those are standard things for a lot of hospitals, but just make sure you discuss that with your specific hospital. Some things that you can have control over to make you feel more calm and secure is having as minimal amount of light as possible. Have calming music. If you have a diffuser, bring your diffuser with your oils. So overall, the best way to make the most out of this crappy situation is to talk with your nurse. Your nurse is going to be your best friend in labor if you do not have somebody there, if you are not allowed to have support there with you. So talk with your nurse. Tell her what your expectations are, what your needs are, if you want to have an epidural, if you want to go natural. If your spouse can't be there, FaceTime them, ask if another nurse can hold the phone so your spouse can see what's going on. I don't know which angle they want to look at, but FaceTime or Zoom can be a great way to make them feel a little bit more connected. I know this is really tough on the significant other too, and my heart goes out to all of you, and I pray daily for peace for you all. So a lot of fear can actually come from the unknown. If you have no idea what to expect from what's going to happen in labor. I wanted to talk about what's going to happen if you're in labor, and then what's going to happen if you're induced. So if you come into the hospital, you're in active labor, you're contracting every 3 to 5 minutes, they feel strong, your cervix is a 6, really soft, thin, you're going to be admitted. You'll be placed on the Sono and Toco, which means we're going to be monitoring your contractions and the baby's heart rate, and we'll admit you, get an IV in you. A lot of times, if you're just coming in labor, we can leave your IV disconnected. You don't have to have any fluids. We just need it there for emergency purposes. We let you labor. We help you change positions. We help you get as comfortable as possible, especially if you don't want an epidural, you want to go natural. We do our best to help you manage your pain naturally. If your labor kind of stalls out, your cervix stops making any change, that's a discussion, especially if your water's broken, that's a discussion that you and your doctor will have to have. If it's been a while since your cervix has made any change and your water's broken, your doctor will more than likely start Pitocin to increase the strength of contractions to help push the baby down, open your cervix, get the baby out. We don't want infections. That creates a whole other concern. And if you have to be induced, don't read any stories. Everybody posts all their negative horror stories on, inductions or things that went wrong. Try to stay within a positive mindset and try to have a good conversation with your doctor on what process they use. Typically, it's mostly the same. I had to be induced. I was induced at 38 weeks for preeclampsia. I came in, they started the induction process at like 6 p.m. I got what's called Cytotec, so they place it vaginally, let it sit for 4 hours. It softens your cervix, and then what they also did was place a cook balloon. So we have 2 types of mechanical dilators that we use. A cook balloon can be blown up. There's 2 little balloons, and they blow up on the internal and external part of your cervix, and they put pressure to help mechanically open your cervix. The other one is a Foley balloon. It blows up a little bit less, and it only goes on the inside of your cervix, and we kind of pull on it to help dilate. So I had a cook balloon. They injected it with 80 and 80 ml, so that's the max. It hurt like a bitch. But when they pulled it out, I think I was 6.5 centimeters. After that, they started me on Pitocin, and I think I got started on Pitocin maybe midnight, 1 a.m. I don't know. I didn't sleep much, so I don't really remember the times, but I was able to change positions, breathe through my contractions. I still didn't have an epidural at this point, and the contractions obviously get stronger and stronger, and then a really strong contraction came, broke my water, and I think by 6 or 6:30 a.m., so about 12 hours since the induction process started, I got my epidural, and I always knew that I wanted the epidural. I feel like I could have went longer. I could have went longer without getting one, because I was staying focused in my mental state. I was breathing, swaying. I had my hood rat playlist going, dancing on my birthing ball, just trying to stay out of the zone of, oh my gosh, this hurts, but in the zone thinking about something else. And I got my epidural, laid on my side. I had the peanut ball in between my legs, and that helps to open up your pelvis, help the baby come down, turn side to side. And I think, so they checked me at like 9:30, and I think I was like 9 centimeters. I think shortly after that, I was what we call complete, because I started feeling pressure, but I was only feeling pressure with contractions. So I didn't tell anybody, because I wanted to what we call labor down as long as possible and let the contractions kind of do the work to push the baby down and out as much as possible. So I didn't have to push that long. My doctor came in at like 1:30, checked me, and I was at +3, which means like baby's there. So I only had to end up pushing like 20 minutes. So that's so those are some other tips I want to talk about. Peanut ball. If you have an epidural, utilize that. Put it in between your legs, and have them help you turn side to side every 1 to 2 hours. Us nurses swear by this. This cuts labor time down dramatically, especially if you've had more than one baby. But even if you haven't, it truly helps. And then, what was I gonna say? Oh, laboring down. If they tell you that you're 8, 9 centimeters or even 10 centimeters, some doctors might not agree with this, but in my humble opinion, as someone who has went through this, it really helps to cut down on pushing time when you feel pressure continuously, rather than when you're just feeling some pressure with the contractions. Let the contractions do the work to push the baby as much as possible. And then when you feel continuous pressure, like you can't handle it anymore, like you feel like you're gonna shit yourself, then it's a good time to start pushing. So that was my experience with an induction. Each induction, they kind of follow the same guidelines, but it can go a little bit different based on how your body reacts to it. So we have the Cytotec pills. Those are placed next to in the cervix to help soften. You can get a few doses of that. We have what's called Cervidil. It helps to ripen the cervix. That looks like a little tampon string, goes in your cervix, that stays for 12 hours and then you're checked. Whereas the Cytotec, you're checked every 4 hours. It just depends on what your first initial cervical exam shows. They can do the two balloons, like I said, the cook balloon, the Foley balloon, and then at some point you're started on the Pitocin. Your water might break on its own. They might need to break it depending on what's happening. If nothing's happening, or if you're getting so far along, sometimes they don't break it, and then the baby can be born in the sac, and that's really cool. I've only seen it happen one time. So I wanted to just kind of throw this video together as quick as possible, because I have some some mama friends that are close to delivery. And if you have any questions, anything else that you want to ask, put it in the comments below. I'll get back to you. Just remember, you can do this with or without your spouse. Your nurses are here to support you through it. We want you to have a positive birthing experience. It does suck. It's a shitty time to have to deliver just because hospital mandates, but we want to keep you and your baby safe. Mama, you can do this. You were born to do this. Your body is made to do this. You can deliver your baby. You've got this. Hope you have safe, happy, healthy deliveries. And like I said, if you have any questions, drop them below. I'm sure I'm gonna hit done recording and remember a few other things that I wanted to talk about. But if you have any questions, drop them below, and have a great day.